I very often tell people that if they ask me to describe the most important thing I ever did in my life, that it was the roles that I played in enabling the Durban conference to take place. And I don't want to pretend that it was an easy time. It wasn't. But certainly it was the conference that changed the world. Durban highlighted throughout the world that it was not acceptable to have two different worlds. One world in which everybody could take access to antiretroviral drugs for granted, and a different world in which the drugs were virtually non-available, which meant that anybody who contracted HIV in a developing country setting was more or less, at the time, condemned to die. And people came away from the Durban conference, including politicians, saying this situation is untenable, we cannot allow this situation to continue. And of course, some of the politicians, including from Canada, who were at the conference, went home, reported to their governments, and then governments throughout the world started to enact measures that would result ultimately in a great change. Well, I think AIDS has in many ways been a model for many other diseases. I think AIDS activism really has spurred activism in regard to many other diseases. For example, I think in every country of the world now, there are breast cancer activist groups, and I don't think those existed to nearly the same extent as they did before HIV/AIDS. At my age, of course, I'm becoming of the opinion that prostate cancer activism is something we need to do much more seriously. But also, even in regard to prostate cancer, I think we're seeing a degree of activism that did not exist before. And I think really it's all because of HIV. It started with HIV, and it spread now to many other diseases. So it's been a very good thing. The manner in which HIV drug development took place, I think, has directly influenced, as an example, the development of all of the drugs that are either now approved or will be approved to combat hepatitis C infection. So the hepatitis field, really has been a direct beneficiary of work in HIV. Just in the same way, I think that HIV clinical trials research really was very much based on clinical trials in cancer. And, each disease interacts with every other disease. Right now we're seeing, as an example, a lot more cancers in HIV-infected people than in the population at large. So obviously there are linkages, with every other disease, and we are all interdependent. And there are probably many examples, really, of how HIV has benefited other disease conditions. Again, to give a very precise example, several of the drugs that we use to treat HIV have had direct impact in regard to hepatitis B virus, the drugs in question being 3-TC, FTC, and tenofovir, among others. So, this is a direct benefit. And some of this was not predictable at the time that the HIV drugs were first developed. The IS, was formed in response to a grave crisis situation, and there's no question that the IS has been very, very successful as an international organization, NGO, if you will, in some ways, as playing a major leadership role in the fight against AIDS. These conferences are not only scientific conferences, and by that I mean scientific conferences over all of the spectra of science, including social science, basic science, clinical science, epidemiological sciences, and so forth. But these conferences have also served as magnets for attracting decision makers. On the side rooms, people make important decisions about funding, about which projects they consider important, and whenever there is an important announcement at a conference like this, you know that the press is going to be jumping on an announcement, and the media are here to report back what was said. And the decision makers from the foundations, they want to be here as well in order to be available to the press for interviews. There are a few good examples of this kind of thing. As an example, the report several years back of the first success of a microbicide, right? The Caprisa 004 study, which was reported at the Vienna conference. Well, all of the funders were there. They knew what was going to happen, and the media were there, but it was very important, for that coalescence to take place, and it did because of the conference. Well, I think the power of the IAS is that it's truly international, and it's democratic. The membership is democratically elected from different regions of the world, and that really gives it a legitimacy that you would not have in regard to many other organizations. One of the difficulties now is that we're almost a victim of our success as a field. We've done so well in regard to drug development and getting the drugs to work with much less toxicity than before and much greater efficacy than ever before. So, with fewer people dying of HIV, the press sort of have the attitude, this problem has been solved. Of course it hasn't, and of course we know that it hasn't. If we could cure AIDS, we need to understand that taxpayers will benefit throughout the world. It's not only the people who are infected by HIV who will benefit, but I, as a taxpayer, will also benefit in this very personal way, as you will, as will everyone living in the United States. So we have to get people to identify with the need for a cure, because really it's going to save a lot of tax dollars to be available for other things. I'm an optimist. I think we're going to be able to cure HIV over the next 2 decades. I really mean that. I think that the research community is for the first time galvanized toward accomplishing this goal. And I think our understanding of HIV disease has grown so much in regard to how the virus does what it does, in other words, pathogenesis, that we will soon have many more tools available to us to combat HIV and hopefully cure HIV than have been available until now. So I'm a real optimist in this regard. I have to say I would put my money on a cure, perhaps even before we have a prophylactic vaccine, because it just seems that developing a vaccine might be too difficult. HIV is a very special agent. It crosses mucosal barriers. It multiplies and mutates all the time. First and foremost, there are not a lot of examples of success stories involving vaccines against sexually transmitted diseases. The glaring example of a success story, of course, is human papillomavirus. You could perhaps argue hepatitis B virus as well to some extent, but it's really papillomavirus that has stood out as the great success. But that's not a virus that mutates all the time. And here we've got perhaps different layers of challenges, beginning with the route of infection and the role that dendritic cells play in initiating early stage infections. So the conceptual problems in regard to HIV vaccine development are perhaps greater than the conceptual problems involved in regard to something like human papillomavirus. I certainly hope we wind up developing an HIV vaccine. And yes, research into that field, of course, should continue. But I'm really optimistic that we'll have a cure. And really, in the long run, we want both of these to be successful, right? Because even if we do get a cure, it's still going to be important to prevent new infections. The old adage is still true: prevention is better than cure.